Hello to all, I am Dr. Vishnu. So, welcome to a Smart Learning series, and I am inaugurating the Smart Learning series with the topic diabetes. So, as I had told you about my detailed plan of guiding you, you can check out my Monday's video in which I have actually explained in detail how I am planning to guide you. So today I'll be starting with diabetes, and basically I am going to cover diabetes as a whole. So it doesn't mean that I'm going to talk about only anti-diabetic drugs. I'm going to talk about diabetes as a whole. So since the entire chapter is going to be very, very exhaustive, because obviously you know very well that diabetes is a huge topic and anti-diabetic drugs are a bigger topic as well. So I have decided to fragment important aspects of this chapter into separate videos. And all these videos will be collected under a playlist known as diabetes, which you can get in my YouTube channel. Okay. So today I'm going to talk about the types of diabetes, the normal glucose mechanism or the normal glucose regulatory mechanisms, and what happens in diabetes as a part of pathophysiology along with clinical manifestations. So how am I going to explain you? So basically I always tell you that I have a habit of making my own notes. So when you make your own notes, you can make very good PowerPoints also, because same thing you are converting into slides so you can present to people better. So what I have done is I have made my notes till clinical manifestations. I converted them into simple slides which are easy for you to understand, and I will be presenting that to you in the form of a short video. Okay, so the slides will be shown on the screen and you can follow it along with my explanation in the background. So please make sure that you watch this video till the end, because this video is going to give you simple yet amazing information regarding diabetes as a disease. Okay, so let's start. So in this video, I'll talk about diabetes as a disease. So this is the first part. So in this video, you can expect the following headings. In this video, I'll be talking about definition, means what is diabetes. Then I'll talk about types of diabetes. Then I'll talk about normal glucose regulation, like how glucose is regulated in the body, or how it is elevated, or how it is controlled. Then I'll talk about pathophysiology of diabetes. So in that, I'll cover how type 1 and type 2 occurs. And then I'll talk about clinical manifestations in very simple words so that you can remember it easily. So this can be good for your exam perspective, and it is also good for smart learning, because smart learning is way beyond exams. It's way beyond bookish knowledge. So without wasting any time, let's begin. So basically, according to the American Diabetes Association guidelines, diabetes is defined as a condition in which it's a chronic condition in which you get hyperglycemia, that is high blood glucose level. So this can happen due to three reasons. So three reasons are mentioned here. Either due to reduced insulin production, or reduced insulin potency, or both. So reduced insulin production can happen in type 1 diabetes, especially in type 1 diabetes. You know very well that it is complete destruction of beta cells. So that is why the drug of choice in type 1 diabetes is insulin currently. Reduced insulin potency means quantity is there, but it is not able to show that much of an activity. And both can also happen. So this is a definition of diabetes mellitus. Now let's look into the types of diabetes. So basically there are 6 types. And if you look at the first point that I mentioned, it is not exactly diabetes, but it comes under diabetes because I mentioned it under diabetes because it is a condition of hyperglycemia. So I just mentioned it. Catamenial hyperglycemia. Now, many of you may think, whenever we talk about diabetes types, always we start with type 1 and type 2. Why did this person start with catamenial hyperglycemia? See, this is where the interesting part comes, because this is a term which many of you might not be aware of. And this is actually very, very interesting. And that is why I purposely thought that I should mention this first, because all of us know about gestational, type 1, type 2, and all these things. But when it comes to this thing that you are showing, that you are seeing on the screen right now, something that many of you might not know. So this is defined as hyperglycemia during periods or menstrual cycle phases. Actually, the meaning of catamenial is once in a month. So there is a condition known as catamenial epilepsy. So that also happens during menstrual cycle. I'll talk about that during my epilepsy and seizure series. So catamenial hyperglycemia is related to hyperglycemia during menstrual cycle phases. Always remember, progesterone and glucose are best friends. Just like estrogen and insulin are best friends, similarly, progesterone and glucose are best friends. And that is why progesterone always helps in increasing blood glucose levels. And that is why when the level of progesterone is reduced, glucose level also gets reduced. So now you might have understood what this condition is. So progesterone increases blood glucose level. So during the luteal phase of menstrual cycle, there is high progesterone activity. You know very well, if you refer menstrual cycle, if you look at the luteal phase, there is a huge effect of progesterone. So that time, blood glucose level also elevates. So this is actually not very common, but if the female is already suffering from diabetes, or if the female has obesity as well, then this thing might be bothersome. And that is why there are certain case reports, there are certain reports in which some females have experienced severe hyperglycemia during their menstrual cycle. So this is called catamenial hyperglycemia. And you know about type 1 diabetes. Type 1 diabetes is almost like an autoimmune condition. Autoimmunity means what? Auto means automatic, immune means your immune system. So it is automatic immunity. What do you mean by that? Your body's immune system considers your own body as enemy and starts sending antibodies towards it. So in this condition, autoimmune destruction of beta cells of islets of Langerhans, because beta cells actually release insulin and amylin. So the insulin quantity gets reduced. It is almost like zero. And that is why in type 1 diabetes, we mainly directly use insulin. This is usually seen in children, mainly seen in younger age. Type 2 diabetes is much more common. It occurs above 30 years of age. In this condition, either insulin is produced, but the quantity is too low, or insulin quantity is there, but its potency is not there. Please remember, when insulin's quantity is there, but the potency gets reduced, it is called insulin resistance. And that is why you always hear the term insulin resistance. So insulin resistance is usually seen in type 2 diabetes. So the risk factors can be family history, like if your parents, first degree relatives have this condition, then you can have it. And insulin resistance can be caused by increased triglycerides. Like, for example, if you have hypertriglyceridemia and associated obesity, then actually it is an indication of insulin resistance. And also, if HDL cholesterol gets reduced, then also it has been seen that it can progress to insulin resistance. Now we come to gestational diabetes. So this is hyperglycemia during pregnancy. And this can happen, for example, if a female is having PCOD and she is pregnant, or if the female is already obese, her BMI is very high and she gets pregnant. These are certain risk factors that may predispose the female to have gestational diabetes. And it is actually very, very, very important to control blood glucose levels during pregnancy. Because if it is not properly controlled, then it can increase the risk of preeclampsia, that is hypertension during pregnancy. It can cause macrosomia. So macrosomia means children will be born with abnormally high weight. So that is called macrosomia. And shoulder dystocia. The shoulder dystocia is a condition in which one or more shoulder of the baby is stuck during vaginal delivery. So this is only applicable for normal delivery. In shoulder dystocia, during the normal vaginal delivery, one or both, either shoulders of the neonate or the child who is going to get born gets stuck. So this kind of conditions can happen if gestational diabetes is not properly controlled. Then we have something called pre-diabetes, and this is a warning sign. You have to be very, very careful. And unfortunately, many people in this world do not know that they are pre-diabetic. So it's very, very important. That is why occasional, maybe body checkups, full body checkups, or occasional, especially if you have a family history, then definitely occasional body checkups is actually warranted, because you may not know when you progress to pre-diabetes. So in this condition, there is actually elevation in blood glucose level, but it is not as much as the person can be classified as diabetic, but there is elevation. So it is actually like a warning sign. But if it is not detected and properly controlled with lifestyle modification, dietary patterns and all, then definitely the person will progress to type 2 diabetes. That means insulin resistance. So pre-diabetes is actually like a warning for you. If you want to be careful, be careful. Otherwise, it may be too late. Then we have other types of diabetes, that is called MODY, maturity onset diabetes in the young. So maturity onset diabetes in the young means there are certain cases in which young population get type 2 diabetes. Usually what I told you is type 1 diabetes happen in the young. But in MODY, it has been seen that the younger population have got type 2 diabetes. So in that condition, it is known as MODY. Then we have LADA, latent autoimmune disease of the adult. So as I told you that type 1 diabetes is an autoimmune condition that happens usually in the young population. But it has been seen that certain adult populations have developed type 1 diabetes. So in that condition, it is called LADA. And there are certain conditions and medications that can actually increase blood glucose level. For example, Cushing syndrome, we have acromegaly. Acromegaly is actually, acromegaly means, your growth hormone is involved, and growth hormone has a very important role to play in increasing blood glucose levels. If you have certain pancreatic disorders, because islets of Langerhans are present in the pancreas. So if you have pancreatic disorders, that can also cause dysregulation in insulin activity, which can lead to diabetes. And there are certain medications that can actually cause insulin resistance or reduce secretion of insulin. For example, steroids, corticosteroids, phenytoin. Phenytoin is very, very famous for causing insulin resistance. And we have atypical antipsychotics, second generation antipsychotics, that are also notorious for causing metabolic syndrome and then leading to diabetes. Now let's talk about the normal glucose regulation. So there are 4 factors that are involved in normal glucose regulation. We have insulin, counter-regulatory hormones, incretin hormones, and amylin. So we will talk about that one by one. So insulin, you know very well what it does. That is the thing that we require in our body properly. Otherwise, diabetes will occur. So it has actually 5 actions and they are mentioned here. So basically, insulin increases the uptake of glucose. So it produces energy in the form of ATP, which is actually required by the body. Insulin converts glucose into fat and glycogen, and that is stored in adipose tissue, liver, and muscle cells. Please remember, this is very, very important. And that is exactly the reason why insulin can also cause weight gain as an adverse effect. Why? Because insulin is converting glucose into fat, which is getting stored in the adipose tissue and liver. So if you are having high levels of insulin in the body, which actually also is an indication of insulin resistance, then it has been seen that certain patients develop fatty liver. Because when fat is getting accumulated in the liver, especially more than 5%, it is called fatty liver. And obviously, if fat is getting accumulated, then it can cause obesity also. So this is a practical knowledge. This is something called smart learning. And that is the reason why insulin can cause weight gain as an adverse effect. Insulin also increases the uptake of amino acids. Insulin also reduces the glucose production by the liver, because you know very well, the liver helps in two major processes if you have studied in biochemistry. One is called gluconeogenesis, that is formation of glucose, and the other is called glycogenolysis, that is breakdown of glycogen into glucose. And also insulin increases the breakdown of fatty acid into ketones. Now let's talk about counter-regulatory hormones. So these are certain hormones that actually block the activity of insulin. So we have 4 hormones here that actually block the activity of insulin. So they are known as counter-regulatory hormones. For example, growth hormone, as I said some time back about acromegaly. Cortisol, it is a steroid, corticosteroid, naturally occurring corticosteroid. Catecholamines, adrenaline, noradrenaline, these are all catecholamines. They also, block the activity of insulin. And obviously, glucagon. Glucagon is actually released by the alpha cell of islets of Langerhans of the pancreas. Now let's talk about incretin hormones. This is very important because when you study about medications used in diabetes, you might remember that there is a medication known as, there is a class of medication known as GLP-1 agonist. Glucagon-like peptide agonist. We have semaglutide, liraglutide, dulaglutide, lixisenatide, etc., etc. So incretin hormones are of 2 types. One is called gastric inhibitory peptide and the other is called glucagon-like peptide. So basically you need to understand that in our body, to maintain blood glucose levels, GIP should be low and GLP-1 should be high. In diabetes, what happens? GIP is high and GLP-1 is low. So basically what happens, for example, when you are consuming food, when you are eating food, it contains carbohydrates, whatever it is. So when glucose goes into your body, your intestine releases 2 hormones, that is GIP and GLP-1. So GLP-1 actually helps in controlling blood glucose levels. So you have seen the actions that I have mentioned here. So the GLP-1 has 4 actions. It increases the production of insulin. So basically it reduces blood glucose level. It reduces glucagon production. It increases the activity or the growth of beta cell, because beta cell is important. Then only insulin will be released properly. And it also causes anorexia. This is very interesting. That is why if you are having diabetes and you are also, struggling with maintaining a good body weight, if you are having type 2 diabetes and you are struggling with maintaining a good body weight, the GLP-1 agonist is a good option after metformin. Because GLP-1 agonist causes anorexia as a side effect. And this is actually good because when you have anorexia, definitely it will lead to weight loss. Then we'll talk about amylin. So basically we have 3 cells of islets of Langerhans, alpha, beta, and delta. Delta produces somatostatin. We'll talk about that when we study liver cirrhosis. So here we'll talk about alpha and beta. Alpha produces glucagon, which increases glucose, and beta produces insulin and amylin. So amylin is a hormone secreted by beta cells. In type 1 diabetes, no amylin is produced at all. Just like no insulin is produced because beta cell is destroyed. And in type 2 diabetes, amylin is produced, but the quantity is less. Now let's talk about the pathophysiology of diabetes. So I'll talk about type 1 and type 2 because that is much more common. So here you can see that I have mentioned 3 factors. Number 1, genetic predisposition, environmental causes, and autoimmunity. So genetic predisposition does not mean that if your parents have type 1 diabetes, definitely you will also have that. It is not so necessary. But in type 2 diabetes, actually genetic predisposition has a huge role to play. Like for example, if your parents have type 2, then your chances of getting type 2 is high. But the same thing is not applicable that much for type 1. So here genetic predisposition means if there is mutation in certain genes of your body that can predispose you to type 1 diabetes. For example, if you have mutation in HLA gene, DQA and DQB, these are certain genes. If there is mutation in that, it can cause destruction of beta cells. And there are certain environmental causes. It has been seen that cow's milk may predispose a person to type 1 diabetes. It's not necessary that it will happen to all, because so many people drink cow's milk. It doesn't mean that everybody are type 1 diabetics, but it has been seen in certain patients. So that is why this can be considered as a risk factor. Viral infection, especially rubella virus and Coxsackie virus. So these two viruses have been implicated in increasing beta cell destruction, leading to type 1 diabetes. And then about autoimmunity, I have already said that to you. Autoimmunity means your body's immune system will send antibodies towards your own body tissues. So, and if there are antibodies to insulin or antibodies to beta cells, definitely both of them will get destroyed. That can cause type 1 diabetes. In type 2 diabetes, the situation is a bit different. Here also genetic predisposition is there, but it does not mean it is mutation oriented. Here it means if your first degree relatives, your parents, if they have diabetes, especially type 2, then your chances are high. It doesn't mean that you will definitely get it. Please remember, it doesn't mean that you will definitely get it, but chances are high. Similarly, beta cell dysfunction. Beta cell dysfunction means insulin resistance. What do you mean by insulin resistance? Insulin is there in the blood in high quantity, but it is not able to show its blood glucose controlling capacity. That is called insulin resistance. You can actually compare it with antibiotic resistance also. You are giving antibiotic for an infection. The antibiotic is there in the body in good volume or in good plasma drug concentration, but it is not able to do anything against the bacteria. Similarly, insulin resistance also means the same thing. Large quantity is there in the blood, but it has completely lost its potency. Then we have peripheral side effects. That is not so important. I just mentioned it. If there is any damage in the insulin receptor or something, that is not so important. Just this genetic predisposition and beta cell dysfunction is something that you need to consider. So this can lead to type 2 diabetes. Now let's talk about clinical manifestations. You will always have fatigue or you will always have tiredness when you have diabetes. And why? For this, you need to see my video. I have uploaded a YouTube video on interesting aspects of diabetes. In that, I have explained how type 2 diabetes makes you feel tired. Because what happens is in diabetes, hyperglycemia. And the cells actually require glucose so that they can generate ATP and give you the energy that you require. But in diabetes, what happens? Glucose is staying in the blood, but glucose is not entering into the cell. So the cells become hungry. And if you are not given food for a long time, definitely you will lack energy. So the cells start starving. And that actually leads to fatigue. And this is also another reason why polyphagia is seen in type 2 diabetes. Because when you are very, very tired, you will always feel like you have to eat. But when you eat food, again, glucose is produced. Again, it is staying in the blood, but it is not going into the cell. So you keep on eating, but you will always feel tired. This is very interesting. Then we come to polyuria. Polyuria means increased urination or urinating tendency. If the kidneys are not able to filter glucose, glucosuria occurs. That means elimination of glucose through urine. This will actually increase your urinating tendency. And because of increased urination also, you get dehydrated. And that leads to the third point that I've mentioned here, polydipsia. Polydipsia means increased thirst. So when you are having polyuria, you feel dehydrated. So that leads to polydipsia. Then we come to polyphagia. Just now I said that glucose is not entering into the cell and the cell is very, very, very hungry. So the cell is telling you that I am feeling hungry, I am very tired, I cannot work anymore, you have to eat food. Again, you will eat food. But that food is again, getting broken down into glucose, but again it is staying in the blood. Then we come to impotence. So it has been seen that sexual dysfunction, erectile dysfunction is common. It's very commonly seen among patients with type 2 diabetes because it occurs due to low blood supply and also due to nerve damage, because you know that neuropathy and all those things happen in the long term, and also damage to the blood vessels. UTI and infections can also happen because just now I said that glucosuria occurs, and you know very well that bacteria thrives on glucose. So if that is why this kind of patients, especially in type 2 diabetes, this kind of patients are always advised to maintain their genital hygiene, because if they are urinating and if they are not maintaining the hygiene properly, the risk of UTI, urinary tract infections, will be very, very high. So glucosuria increases the risk of infections. And also another reason for infection is that if your blood glucose level is not properly controlled, if you get an injury, especially in the lower part of your body, like for example in the foot, you may not even have the sensation that you actually got an injury. This happens as a complication of diabetes. So what happens, it will keep on bleeding and you will not feel pain, nothing. And you know very well that in diabetes, it is hyperglycemia. So bacteria will multiply and it can lead to diabetic foot infections also. That is why patients with type 2 diabetes are advised that you should focus on wearing proper diabetic footwear, especially if you are working in farms or if you're walking here and there or anywhere where there is a risk of getting, your foot injured and you may not even know about it. Blood vision is also seen. Basically, it is actually a complication, like it happens in cataract, which is actually, it is associated with diabetes. So in diabetes, what happens, a whitish membrane or a whitish cloud forms on the lens of the eye, and that can lead to cataract. And also diabetic retinopathy is seen because of the damage to the optic nerve. So that can increase the risk of blindness. So I hope that you have got an insight into how I wish to guide you. I hope the slides that I have mentioned about types of diabetes, normal glucose regulation, pathophysiological mechanisms, and clinical manifestations has been clear for you. If you have any suggestions or if you have any doubts, please feel free to contact me on Instagram. And since the effort that I am investing in you is very painstaking, it takes a lot of time, please make sure that you do a favor by subscribing to my YouTube channel and following my Instagram page. And I do promise you that I will come back with more amazing updates. So in the next video, in this session of diabetes, I'll talk about insulin in detail. What are the things that you need to remember when we study about insulin in a smart way, just like as I mentioned in the slides, limited information in maximum smart learning perspective. So thank you so much for watching till now. I hope this information is productive for you. See you in the next video. Until then, it's bye.